Hola, hola, gal. It's JW, and I'm really excited today to talk to you a little bit about hormones and perception. This is something that I don't feel gets enough attention, and that's why we're doing it, of course. And I think that many times I hear patients say, I feel outside of my body, or I know this isn't me. I am not responding the way that I would like to. I feel like I don't have space. Everyone tells me I'm fine. I don't feel like I'm fine. Things like that. And I would like to first of all reassure everyone in the fact that we are this beautiful and complex machine that is interacting with so many factors that are both seen and unseen. And the way that we are responding is carried out through hormonal responses. And that's always what's fascinated me is that we can look at behavioral patterns, perception patterns, and hormonal patterns and draw similarities and draw um, kind of some great linear points from perception of self and hormonal responses and the balance that can give space to optimize those responses. So, let's start talking about some of the feelings that are associated with specific hormones and looking at the balance of one hormone to another. So, estrogen is what we would call a lioness molecule. This is a molecule that causes the ability of your blood vessels to respond quickly. And we look at it as a molecule of motivation. It's when a woman, we see this big influx when she's ready to go out and get a job, have a family, be protective, be productive. We have a higher level of estrogen. And what's interesting is if we look at how estrogen affects our health in the earlier lecture, in the earlier segment, we understand that the vitality is very connected to longevity, the ability to adapt and increase this hormonal response is really important. Now, what happens is estrogen can fluctuate, and in relation to progesterone, it's really important. Progesterone is more of a chill out molecule. This molecule allows us to feel safe. It helps our thyroid receptors be open, so we're able to respond to all that estrogen and do what we need to do. So progesterone gives us a space to kind of organize our thoughts and feel safe, calm, and able to respond to the motivation, the adaptability, and the I guess, forward motion of estrogen and that perception. What happens when these get out of balance, we often see this fluctuation be a depression, a lack of ability to want to do anything, no motivation, or on the other side of the fluctuation, a frustration and anger with almost anything and everything that's completely unrelated, and an anxiety, and not feeling safe. And that's because these hormones work in relation with one another, as all hormones of the body do. And so we can see this more obviously reflected when, say, you wouldn't be angry about something. It's not a big deal. Normally wouldn't frustrate you. And all of a sudden you feel a heat in your chest and it rises up and you're very frustrated. And that's an estrogen feeling, right? Progesterone feeling is kind of sleepy, chill. I'm good with everything. And think about increasing progesterone so much during pregnancy, and that kind of is at the severe end of that feeling, right? And then we look at testosterone. Testosterone is known for giving us a feeling of well-being, if I can handle it on my own, and it really does that through those physical responses of how it works on our health as well. And we can see that when testosterone receptors get overly stimulated and we have too much of that, we have a burnout feeling, right? The burnout feeling is where we normally will start to kind of correlate the cortisol, the DHEA, that type of response is what we've heard of in adrenal complexes, right? So higher cortisol is more stressed, more responsive on this, almost when you give someone the cortisol a cortisone pack, which is what we do in like acute care in traditional medicine. I say traditional, it's like the shortest amount anyways. So that can cause anxiety, like a lot of activity and nervousness. And so at the high end, we can have those responses. And at the low end, it's an inability to respond, to regenerate and repair and kind of adapt to when we need to utilize that cortisol, remembering that it's a homeostasis for everything. And there has to be an ebb and flow and up and down cortisol rhythm, especially making sure that we have our elevated levels, our higher levels in the morning, and we utilize that throughout the day and create a environment that we can go completely down to the lowest level so that we can not have any of that activity and create a complete relaxation state to repair and rest throughout the evening before we respond again the next day. And that rhythm and adaptability is what's most important to remember when we're looking at cortisol. So the perception that is part of these responses of our hormonal balance is directly related when you think about depression, when you think about anxiety, because these hormonal responses have to do with the input that we're getting from our environment, not only the direct input from our nutrition, which is important in all of these states, our activity level, which is important in all of these states, our hormonal balance in the form of if we have any drug interactions, if we're taking any botanicals, if we are trying to modulate that in any way to be cognizant of it, our cortisol rhythm, our waking and sleeping cycle, the people that are around us and the input that we're getting from those hormonal responses, really important how much time we're spending outside, enjoying things we're doing, self-care. This is all really, really important for our perception, which then feeds our hormonal responses. Because those inputs, everything from your environment, is then filtered through your perception into hormonal responses, which then you perceive again and create an environment that we perceive again. And this is the way that we can slowly, steadily, and certainly look at how our hormones are setting up our perception at this time so that we can get a handle on it, stop giving so much ownership into I feel this way, this is just the way I am, and realize that we can implement a balance that is most optimal for your wellness goals, and we can perceive the best optimal. Look how I'm like writing on jazz. The optimal life for you, which creates wellness. So remember that sometimes instead of putting so much responsibility on yourself and thinking that we can immediately create these changes, and I should feel this way and I'd like to feel this, and I'm frustrated that I don't make these changes, to give ourselves the comfort of realizing that we are a complex and beautiful piece of machinery, and that our overall wellness is connected to our overall perception and our overall enjoyment, and that by balancing all of those elements, just by paying attention and making small changes, one little thing at a time, that are all enjoyable, that we can perceive something even more optimal and continue to walk down that wellness path. I'm so glad to be walking with you and talking about how hormones affect perception.